Masters and Logan Motivational Media presents Dr. Jack's Pulse Nation with noted cardiologist Dr. Jack Hauser answering all your questions. And now, the man of the hour, Dr. Jack.
Good morning. I'm Dr. Jack Hauser, and this is Pulse Nation. Thank you for joining me this morning, and I'm going to be your new best friend. If you have any questions whatsoever regarding your health and your heart and any matters pertaining to how to live longer and live better. I understand we have some questions right out of the box.
We do, Dr. Jack, we do. I have an email here from Jane S. from Pennsylvania. She's very confused about cholesterol. Now, she's been to two different doctors. One doctor said you need to be on statins. The other doctor said, no, don't worry about that. Her HDL, the good cholesterol, is 63. Her LDLs are 155. One doctor said that's a little too elevated, wanted her on medication. What say you, Dr. Hauser?
What's your name? Jane? Okay. But Scott, if I do this, right, we're okay, right?
Yeah.
You don't give a shit, right? You don't give a shit, right? You just let's split,
Right.
right? Okay,
It is
Jane.
good.
Okay,
Sure.
Yeah.
okay, and from Pennsylvania.
Yes.
Okay.
You can make yourself notes, too.
Yeah. Okay.
Yeah.
Well, Jane from Pennsylvania, let me reassure you that with respect to your confusion regarding cholesterol, you're not alone, because so many doctors are also confused about this issue. First of all, let me remind you and all of our viewers. Oh, God damn it!
That's okay. But that's all right.
So let me. Huh?
Wait,
Okay.
we're going to have to start this over anyway because
Yeah.
you said good morning.
Yeah.
So you don't say good
Oh, yeah,
morning.
okay, right,
Just say,
okay.
Hi, I'm Dr. Jack
Okay.
Hauser. Yeah.
Oh, I said good morning, right? Okay.
Well, let's keep hammering it through just
right.
just so we get the structure down.
Okay,
Just for
okay.
Okay. So just continue on.
Yeah.
Okay. Well, Jane from Pennsylvania, let me reassure you, you're not alone, because we're all confused about what to do with cholesterol. I can tell you that cholesterol, the nice thing about measuring cholesterol is that it's a number that we can get easily from drawing your blood. And of course, many doctors, many people can relate to that because it's so simple and concrete. However, remember that cholesterol is only one small factor in a larger equation of what it means for your heart health. As an example, your age, your weight, your activity level, your general mood. What's your blood pressure? Do you have diabetes? Did your mother, father, or uncles perhaps have heart disease? So as you can see, these are all of the components to a broad approach that we like to use. But if we stick to the level of cholesterol, then yes, let's talk about what these numbers truly mean. You say that there's an LDL of 155. We know that L, and I like to say to my patients that the L stands for lousy. Nobody ever forgets it then. The lousy cholesterol, the LDL cholesterol. As a rule, we would like everybody's LDL level to be less than 160 in any typical blood test, usually a fasting blood test. If you have any heart disease or you have other what we call risk factors for heart disease, such as diabetes, being overweight, high blood pressure, if you smoke, then we want to be more aggressive and more rigorous in approaching the levels of LDL, and perhaps then we want to strive for an LDL level that's less than 130. And to take it one step further, if you actually have documented heart disease, if you have had bypass surgery or a documented heart attack, then we need to get that LDL level even lower. And that number would be less than 100. So as you can see, based upon you as an individual, all of the factors that define who and what you are, we would then approach your cholesterol levels on an individual basis. So I would like to know, do you have any heart disease? And I don't know what your age is, but if we take this in the abstract, I can tell you that an LDL of 155 does put you in that range where if everything else looks fine, I would not give you any medication. No, I would not. You further mentioned your HDL. And let's let H stand for healthy. So your healthy cholesterol, we want to be high. And remember, your LDL, your lousy cholesterol, we want it to be low. How high do we want your HDL, your healthy cholesterol, to be? Well, again, theoretically and as a general rule of thumb, we would like your HDL to be over 50. Now, that's more so for men. We're a little bit less stringent with young women, with premenopausal women, because they have estrogenic protection. So let's just say, in your case, we will give you the number of 40. So we'd like your HDL to be above 40 at all costs. And I hear that you say your HDL is 63. So, good news already. You're in that good group of people, and we don't need to react with alarm or worry. In your case, it doesn't appear to me as though you actually have an actual heart problem. And so I would say to you, with these numbers, an LDL of 155, not that bad. An HDL of 63, pretty good. You do not need to be on medications, and in particular, a statin agent at this time. Of course, I would say you need to eat properly. Nutrition is going to be the key for keeping these numbers at levels that will help you now and into the future. And in particular, we want to keep your level of saturated fat to relatively low levels. And again, I think a lot of that is common sense, and we can talk more about nutrition as we go along.
Dr. Jack, we're getting more emails in off of this. Hank, I don't know where he's from, but he wants to know, do the numbers stay the same for men? He is 45 years old. He said he has similar numbers to what you're reading there about Jane. And he has heart disease in his family, though. Both his parents died in their 70s from congestive heart failure. He does not smoke. His weight is great. He exercises. And he wants to know, is the advice you're giving for Jane, does that pertain to him as well?
Again, I think we're talking now about the differences in gender amongst individuals with similar levels of cholesterol. And again, I would approach it by using the general equation. However, in this case, Hank, who already has a very significant history in his family, first-order relatives of heart disease, already makes me want to react with a little bit more action up front. And perhaps I would consider Hank to be a candidate for medication therapy at this time. However, I do want to say that should never be a substitute for keeping your weight down and eating properly, seeing a nutritionist, watching what your total calories and saturated fat intake are. With those recommendations, I would have Hank repeat these numbers in 3 months. And if the numbers remain the same after him perhaps being a good boy, I would then say, given the fact that we cannot unchange his family history, I would probably put this gentleman on medication. But I would not put Jane from Pennsylvania on medication.
So, Dr. Jack, what if Jane had the same family history? Are doctors treating men differently than women when it comes to those numbers? Would you put Jane on statins if she had that family history? Or is men still looked upon as that they're more at risk?
I don't think that there is a particular distinction between gender when we talk about treating cholesterol. Just as an aside, more women die from heart disease in America than men. And as you know, more women die from heart disease than they do from breast cancer. So we take women who come to us with issues of cardiac prevention very seriously, and at least as seriously as men. So no, I would not distinguish between female or male. If this woman, if Jane had told me that she had parents who suffered from coronary disease or heart disease, then I would be more aggressive. And I would then think about putting her on a medication for that reason. But without that risk factor, I think we can relax a little bit more with respect to Jane.
Well, let me ask you something in general, and I'll speak for all men and women now. I think we're all a little confused about exactly what to eat. I mean, if you can give me one thing, do I stay away from all fats? Is it just saturated, hydrogenated? What is it?
Well, let me paraphrase the words of Jackie Mason, who, as you know, is a very famous Jewish comedian from New York City, one of my favorites. And as he so poignantly put it, we should all just pick a disease and eat accordingly. So what does that mean? It means you know that if you eat an unlimited amount of Twinkies, you're going to increase your risk for becoming obese and developing diabetes. If you eat an unlimited amount of butter and steak, you know that you're going to develop high cholesterol and triglyceride levels, and you'll develop other diseases in that regard. Okay, there are many such stories with respect to drinking coffee and even drinking unpurified water. So again, I think we have to take a practical approach in nutrition and what we need to eat. As a general rule, because everybody is different and everybody has different eating habits, and really therein lies the bugaboo for how we approach our patients. I would say we need to keep, first and foremost, our total level of saturated fats to a general minimum. You know, the Mediterranean heart diet has clearly been shown to result in much less heart disease than a typical American diet. Well, what's so unique about the Mediterranean diet? Well, the Mediterranean diet in countries such as southern Italy and Greece, they eat lots of nuts and seeds and whole grains and lots of olive oil, and those food products are very high in polyunsaturated and monounsaturated oils, very healthy oils to help us, unlike the American diet, which is very high in saturated fat. And of course, I wouldn't be doing you any justice if I did not mention trans fat. And trans fat is our food manufacturer's best friend because it's cheap, it's a great preservative, it tastes great, but boy, does it cause heart disease. So we have to be careful about eliminating trans fat, saturated fat, and I think you know the rest, to keep your total calories down and get good activity and drink a lot of water and get lots of sleep. I know I sound like a typical doctor, but that is really the best prescription I can give you for minimizing heart disease.
I like that. So everything in moderation?
Except having fun.
Okay.
Have a lot of fun.
Aw, that's great. Well, we have a lot more emails here. I think we maybe should address that in your next show. There's a great one on erectile dysfunction.
I am here. I hope that when we get to talk about erectile dysfunction, anybody with a question will be able to straighten out. And thank you so much for joining us this morning on Pulse Nation.